Mr. Nikhil Chopra, CEO, JB Chemicals Pharmaceuticals, Dilip Singh, President, JB Chemicals, dear friends, ladies and gentlemen. It's really a great pleasure and honor indeed for me to be here in front of all of you on a very special occasion after 3 years of COVID, which we all suffered, which separated us. We were active digitally, but now we are going to be active physically. This is the first initiative. I pray to God that we all should continue more and more activities. The main session has all been well introduced to you by Vikas, that today is the national consensus meet from hypertension to heart failure, and there is a special focus on ARNI and Cilnidipine. What is the theme is very well expressed. I think there is a lot of change we see in the armamentarium of our approach to the heart failure, and that is by ARNI. It took some time to understand, but now there is a huge data, whether it's a HFpEF or it is a HFpEF. So ARNI will be the main focus, and we have a very eminent speaker who has been introduced, Dr. C.K. Pandey, who has come all the way from Mumbai to give his presentation. Then we have a talk on Cilnidipine, and Dr. Kuller has been very well introduced, who has a tremendous experience of using this molecule. In what way we can use these two molecules and postpone the need of heart transplant or RVAD or LVAD or even devices. This is going to change the future. Maybe heart transplant may come down. That's a prediction. So I think the data will say very shortly. And ladies and gentlemen, you all know that India is famous up till now as the world capital of hypertension, diabetes, coronary artery disease, stroke, obesity, dyslipidemia, and what not, and now heart failure also. So the time has come, we have to introspect what we should do that none of our patients fall victim to heart failure, because it is a underlying comorbidities which inflicts towards a HFrEF or HFpEF. It's a multi-system disease. This should be very clear to each and every one of us. So I think only yesterday, Ravi Kasliwal has sent me a data from WHO and ICMR, and the data showed very clearly that despite all the best methods we have for last so many years to control hypertension, but a meticulous control is seen only 10%. It's very painful, and it's matter of great concern. So we all have to have an awakening where we are going wrong and what we should do so that we meticulously control hypertension and diabetes, who are the precursors for HFrEF and HFpEF. Second thing, which is also very important in the data I am putting from Indian Heart Journal, which has shown that 42% of patients who are hypertensive, they are not aware that they have hypertension. So I think that's a very, very alarming figure. Uncontrolled hypertension, from my point of view, is a global tsunami, not only in India, but in the whole world. We need to control it to prevent the hypertension inflicted, heart failure, heart attacks, and brain attacks, and whatnot. The focus today, as you heard, is on ARNI and CCB, but we must focus on primordial, primary, secondary, and tertiary prevention. So just putting a device has no meaning. How a device to function with the best medication protocol has to be understood today. So the RD is only 7-year-old molecule. Now, I am in practice for almost 44 years now. I have yet to see any molecule that be gold standard or a game changer. And an iconic approach of this molecule is fantastic. So I think this is the best molecule which we are going to see and its data. And I think 3 systems are very clear to you, which are activated as the age advances: RAS system or NPS or SNS. So this molecule neutralizes all this, and we see the benefits of this molecule in the form of mortality reduction, morbidity reduction, or reduction in hospitalization, or worsening of heart failure, or severity of heart failure. And the most important parameter which I am really motivated and fascinated is the reversal of remodeling. Whether it's a LA, LV or RA or RV or a mitral annulus or tricuspid annulus or aortic annulus or pulmonic annulus or even the flow pattern. So functional remodeling, the morphological remodeling in the patients to reduce the mortality. We are seeing in the patients who have vulnerable hemodynamics with vulnerable metabolism like diabetes, who have vulnerable biochemistry, vulnerable hematology and vulnerable age. So this is the picture we have to consider always. So remodeling, even at the level of cell reprogramming, is seen by this molecule, which is the most powerful potential. Early sequencing, I think all the details will be expressed to you by our colleague, Dr. C.K. Pandey, very soon. Ladies and gentlemen, I must tell you today that Dr. Pandey is going to highlight in a very robust data of 5 Ps. And these 5 Ps are known to each and every one of us. But what is the outcome? What is the consensus? We'll see of these 5 Ps, whether it's Paradigm, Pioneer, Prove, Paragon, Paramount trial, as well as the transition trial or evaluate and meta-analysis data. All these things should be expressed by Dr. Pandey. The second component of discussion today is on the role of cilnidipine. We all know that the calcium influx injury is a real challenge for us. How to prevent the calcium influx injury, whether by amlodipine or by cilnidipine or by azildipine. I think the 4th generation molecule is cilnidipine, 27-year-old molecule with a lot of power, and it will be easily compared to so-called gold standard. And I still don't know in the future amlodipine is going to be gold standard or cilnidipine will take over. I think time will tell us how it will happen. And it is only 35-year-old amlodipine, which is L blocker, as compared to cilnidipine, which is L blocker, as compared to azildipine, which is L and T blocker. The morbidity, mortality benefits by all the data, by Achieve, 1, Carter, and CA10, CA10 subset, all the data will be presented by Ganesh Kuller in a big way. Ladies and gentlemen, the game changer molecules and the gold standard molecules and the iconic molecules will be presented before you. We need your sincere, robust logistic inputs to make this consensus from India to the whole world. With these few words, I request Dr. C.K. Pandey, our first speaker, to have his presentation. Dr. Pandey.